want you to just make an educated decision. I want you to have the knowledge, and that's why I do these videos, so you can make an educated decision. And just it bums me out when people come in and say, I didn't know that, or I wish someone had explained this to me. So I'm giving you the opportunity to make an educated decision. Hey everyone, I'm Dr. Sue Cancer Vet. Thank you so much for joining me for another video. It is October, and that means it's National Breast Cancer Awareness Month. And did you know that dogs and cats get breast cancer as well? In dogs and cats, we typically call it mammary tumors, but it's super important. And if you guys know me and watch any of my other videos, I'm a big advocate of early detection, and early detection makes a huge difference for both dogs and cats. So for breast cancer in dogs and cats, this is really one of the cases where, in general, dogs and cats are pretty different. There's some similarities, and I'm going to point them out. But because, again, it's October and it's Breast Cancer Awareness Month, I really wanted to make these videos. We're going to start with dogs, and the next video will be on cats. I also wanted to, and we'll put the links below, because I have a good number of videos which are also going to be super helpful, and I'll refer to them as we go through these. One is vlog number 73, which is all about how to detect cancer early. And that is really for all superficial lumps and bumps. And breast cancer falls into that as well. So you'll want to watch that. I'm a huge advocate, so I really recommend at the first of every month, or it doesn't have to be the first of the month, but I think that's a good time when you're flipping your calendar. Often we're giving heartworm and flea and tick preventative, to do that monthly lump and bump exam from nose to tail, including the mammary chain. And we'll talk about that dogs have 10 mammary glands and cats have 8 mammary glands. So you really want to feel them on their belly, basically all the way up by their armpits down to their inner thigh area. So that's vlog number 73, and it talks about that. And my skin maps, which are basically these handouts, these printouts that you can print out from my website, Dr. Sue Cancer Vet, in the pet owner resource section. Again, we'll put the link below so you can keep track of all your pets' lumps and bumps. Another really helpful video that we're going to refer to specifically for dogs is when to spay and neuter, and we'll talk about the benefits of early spay for preventing mammary cancer, but it's not that simple. We'll talk about that, but I do want to point out that I do have another whole video, vlog number 62, on when to spay and neuter your dog, that really dives deeper into this topic. And finally, this video is going to be all-encompassing for dogs with mammary tumors, but I have another one on really how to do that lump and bump exam with my perfect little Penelope as a model. I also do monthly Q&As on my Facebook page, and so if you miss those, we'll be doing one in October on dog mammary cancer and one in November on cat mammary cancer. You can also find those Q&As in the playlist section as well. And what you'll find is a lot of pet owners have really similar questions as you do, so those are usually pretty informative and worth watching as well. I hope so. All right guys, let's dive in. Let's start breaking down dog breast cancer. So how common is breast cancer or mammary cancer in dogs? It's pretty common. It's estimated to be the second most common cancer in female dogs. So that's pretty common, with an incidence of about 2 in 1,000 dogs. We typically and more commonly will see it in middle-aged female intact dogs. And as we'll go through, dogs that are intact, that have not been spayed, have a greater likelihood of developing mammary tumors. We still can see it in male dogs. About 1% of male dogs still can get it. So just because you have a male dog doesn't mean they're completely, it's completely impossible, but much less likely in male dogs. Okay, so this is how I break down mammary cancer in dogs. So there's about a 50-50 rule. So 50% are benign and 50% are malignant. And again, that's going to be much different in cats, which have a much more higher likelihood of being malignant. So in cats, about 80 to 90% are malignant. So in dogs, 50% are benign and 50% are malignant. Of the malignant ones, it's estimated about 50% will be cured with surgery. So that's really good news for dogs. So 75% of dogs will be cured with surgery alone, which means only about 25% of dogs, about half of the malignant ones, will need chemotherapy after surgery. And it's based on the biopsy report and some of the other things that will help me or another cancer specialist determine. That's pretty good, much different than cats. So we do know that dogs that have an early spay that remove the sex hormones. So what do I mean by sex hormones? So I'm talking about predominantly estrogen and progesterone. So when you do a spay, you are removing in general the ovaries and the uterus. You remove those sex hormones. And so there will be less exposure for the female dog to those sex hormones, and that will decrease the likelihood of mammary cancer because the mammary tissue is less exposed to those sex hormones. And so we know that mammary cancer can almost be eliminated by doing a spay before the first heat, which makes sense, right? So you're like, no brainer. Of course I should just be spaying my dog before the first heat. But as I'm going to talk about, and again, I talk about in vlog number 62, it's gotten a little bit more complicated over the years. So again, we will talk about that. But in general, early spay can decrease the likelihood of breast cancer. Some other causes that have been associated with breast cancer, so hormone therapy and genetic mutations. So a lot of people, when I say genetic mutations, they kind of like, ooh, what is she talking about? But just think about like women who have like the BRCA mutation, or have certain genetic mutations. So some women with those mutations may have a preventative double mastectomy. So lots of different genetic mutations have been looked at in dogs as well. So what's super important for you as a pet owner, and again, even for us as veterinarians, when we're talking to pet owners and for our own pets ourselves, is early detection. So again, going back to what I mentioned in the introduction, it's super important that we feel our dogs all 10 mammary glands once a month for any irregular lumps and bumps. So please go back. You can see how I do that exam. Going back to my guidelines for see something, do something, why wait aspirate. If the mass is the size of a pea and been there a month, I would like you to go to your veterinarian for a simple aspirate. And again, in both vlog 73 and vlog 60, I talk about that in more detail. So I just want to really point out how small a pea is. So a pea is also the same size as an M&M or a Skittle. So this is the size of a centimeter, which is what we're looking for. And so, really, really small. So these are some calipers. I do sell these on my website. We also have caliper pens as well. You can use, measuring tape, but these are really, really useful for measuring all your lumps and bumps. What's been shown to be predictive or prognostic for dogs with mammary tumors is finding them, the dogs that do best are smaller when they're 3 centimeters. But again, I want to be super proactive and find those lumps and bumps when they're the size of a pea or a centimeter. What I'm saying here is that we know that spaying before the first heat is going to be preventative for breast cancer. Well, why not just spay every dog? There are some newer studies for other cancers like bone cancer, lymphoma, mast cell tumors, hemangiosarcoma, just to name a few, where it looks like delaying spay or neutering by leaving those sex hormones present. So not just the female sex hormones, estrogen and progesterone, but also testosterone in male dogs could help have a preventative effect for some other cancers. So figuring out the right time to spay or neuter is become more complicated. And as I talk about in the other one, mammary tumors are more superficial and easier to find with that monthly exam. Some of the other cancers that I just rattled off are internal. And that is the reason, and again, I talk about that with why I decided to delay my own dog spay in vlog number 62. So please definitely check that one out for a more in-depth conversation about that. All right. Let's get back to mammary tumors. So if your dog has a mammary mass, what's going to happen when you go in for exam? Because I think it's really good to have a reasonable, expectation when you go in. So of course we're going to do a complete exam, and we are going to measure that mass with our calipers because size is definitely one of the things that has been shown to be prognostic or predictive. I also told you if it's fixed or ulcerated, that is going to be more suspicious to me as a clinician, as a doctor, that it could be malignant, and that's going to make me want to do that nice big surgery so we get margins. We usually will do that aspirate. Again, we're going to stick a needle in it, to collect some cells, That is usually not going to tell us if it's benign or malignant for mammary tumors, but just make sure that it's not fat, a mast cell tumor, or something else, you know, in this area going, because, you know, we're talking about a whole area going from, again, the armpit area to the inner thigh area. There are some new studies that do suggest that cytology can tell if it's benign versus malignant, which is going to be helpful for your veterinarian to be able to prepare that surgery. How big a surgery do they need to do? Always, 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 even if cytology tells us what it is, we always want to, did you get that? Always, always, always. We want to submit that tissue that comes off the dog for biopsy, because nothing replaces biopsy, which gives us complete information about the type of tumor. There's all different types of histologic types. So complex carcinomas, they could be a carcinoma, adenocarcinoma, could be a mixed carcinoma, carcinoma sarcoma, and we want to know the grade. We want to know if there's lymphatic or vascular invasion. And I know that sometimes it will give you the option whether or not you want to pay for the biopsy. Yes, yes, yes. So I feel very passionately about that, because sometimes people come to me and they're like, oh, I thought it was optional and I did not submit it. Or you take off 3 mammary masses and you only submitted 1. So dogs are notorious for having mixed ones. So you can have 1 benign and 2 malignant. And if you just happen to throw out the 2 malignant, you may feel comforted that your dog had a benign, you know, mammary mass, but there was 2 malignant ones that you don't know about. So each of the masses should be submitted for biopsy. Okay, so we've done an exam. We always do full blood work and urine. That is not going to tell us anything about the cancer spreading, but it's just something that we want to do before we head to surgery. So most cancers, like if you watch my osteosarcoma one, we're going to do chest x-rays before we go to surgery. Hemangiosarcoma, which was one of the last series, we always do chest x-rays because those have a very high likelihood of spreading and they're usually malignant. This is a little bit different. I just told you 50% are benign. So if there are some of those characteristics that I think suggest malignancy, I'm going to push towards doing chest x-rays and an ultrasound. But I do think that it is reasonable to go to surgery, find out if it was benign or malignant, and then if it was malignant, we're going to go back and do chest x-rays and ultrasound. It's never wrong, and my druthers would be to do the chest x-rays and ultrasound before we go to surgery. But again, knowing that half of them are benign, I don't know that you need to do chest x-rays and ultrasound. On the flip side, guys, middle-aged and older dogs, I really do recommend chest x-rays and ultrasound every 6 months just for general health screening and looking for other cancers. So, you know, if your dog has a mammary mass, probably not a bad time to do those chest x-rays and ultrasound. But if you're working on a budget and your dog has a mammary mass, since half of them are benign, it could be reasonable to go to surgery, find out if it's benign or malignant, or if there was 3 masses, if any of them were malignant, then go back and do the chest x-rays. If any of them were malignant, then we want to do 3 view chest x-rays and an abdominal ultrasound to make sure the cancer hasn't spread. Okay, doc, what's the prognosis for a dog with a mammary mass? As you can imagine, it's super variable, right? I told you that if it's benign, it could be cured with surgery. And then if it's malignant and it has some of the poor predictors, lymphatic vascular invasion, really big, metastasis, it can have a really poor prognosis. So there's lots of predictors. It's sort of like lymphoma. There's just so many studies. So some of the more important ones that I look at and that I encourage veterinarians when I'm teaching to look at is size. Greater than 3 centimeters is one of the ones that has been shown to be predictive. So usually I tell people about the size of my glasses here is about 3 centimeters. So not that big, guys. So again, that's why early detection is so important. Had it spread to the lymph nodes, so it can spread to the lymph nodes in the armpit, the inner thigh, and also lymph nodes in the abdomen as well. It's one of the reasons we want to do abdominal ultrasound. Depending on where along the mammary chain the mammary tumor was, they may remove the lymph node automatically. If it's big, we will often aspirate it before surgery. And then the stage, the WHO stage, which is based on the size, the lymph node, and whether there was distant metastasis. Some of the other really important prognostic factors are things that we're going to look at on that biopsy report. That's why I wanted that biopsy report. So again, we're looking at the grade, were there any cancer cells invading the vascular system or the lymphatic? So I think about sort of that, like the tunnel, the subway, where there's gonna, that's gonna mean that these cancer cells are on their way likely to metastasize or spread. And then we look at the different tumor types, and they're pretty complicated, all the different tumor types, the, carcinoma, sarcomas, so these are these mixed tumors, solid carcinoma, inflammatory mammary carcinoma, which are just absolutely one of the worst tumor types out there. So again, those are the things that we're going to be looking at in addition to the other ones that I mentioned. So how do we treat dogs with mammary tumors? For some dogs, it's just going to be surgery, and that's going to be it. And that's really super nice. And then it's going to be about 25% of those dogs where I'm going to recommend chemotherapy. So what's really important for dogs with surgery is that we get all of it out. And so when the surgeon, the veterinarian, is planning, if there's two mammary masses next to each other, they're gonna take them off as one big unit. If there's like one here and one there, because there are 10 mammary glands, again, it's just that they get all of the affected tissue. Another thing that has been shown to be beneficial is if the dog has not been spayed yet, to spay them at the time, because you're removing those sex hormones, the estrogen and progesterone, and many of these tumors have these receptors, so it'd be to the dog's benefit to spay them at the time as well. And there are studies that show that dogs that are spayed, usually within 1 or 2 years of the mammary tumor, those dogs live significantly longer than they're left intact. So if they are intact when they're diagnosed, we do typically recommend that they're spayed as well. If it's benign, and again, we're going to look at the margins, they don't need quite as wide margins, they're going to be cured of their surgery. Fabulous news. About half of the dogs with malignant tumors, they're going to be cured because they have low grade and they just don't have those high risk factors on their biopsy report. So it's only about half of the malignant ones, about 25% of dogs with mammary tumors, that I'm going to recommend chemotherapy, again, based on their biopsy and some of the other prognostic predictive factors that I talked about. Typically, when do we start chemotherapy? About 2 weeks after their surgery, when their incision's nice and healed. And that's, if you've watched any of my other videos, pretty standard across the board. In general, we try to start about 10 to 14 days. The chemotherapy protocols are a little less standard, with lymphoma and osteo, and we talked about really standard chemotherapy protocol. In general, you're going to get a doxorubicin based protocol. I have recently shifted over to a drug called 5-fluorouracil, called 5-FU. Often with sometimes cyclophosphamide, people will use, carboplatin is used as well, and then sometimes we'll also use non-steroidal anti-inflammatories because they can inhibit COX, so COX-2 inhibitors. So sometimes those will be a good combination as well. So I'd really encourage you to talk to a cancer specialist, if there are new studies out and what is, sort of the current trend in chemotherapy for dogs with mammary tumors. As for the prognosis for dogs with breast cancer, like I said, it's really variable. For those benign ones, they can be cured with surgery. And what's really important is we look at, make sure that the margins, they got wide margins. For benign adenomas, we don't need as wide margins as we do for malignant tumors. So that's something that your veterinarian, your cancer specialist is going to critically evaluate and tell you whether they think there's a likelihood of recurrence and whether or not we can go back and, if we need to do what we call a scar revision to remove more tissue. Sometimes we're limited, it depends on how big that first surgery was. In general, I get a lot of questions about radiation, right? Because we think about radiation for women and breast cancer. We don't typically do radiation just because often the large area, the anatomy of female dogs. So it's really not the standard of care. I would talk to your oncologist about that. But in general, radiation doesn't have a big role in treating mammary cancer or breast cancer in dogs the way it does in women. For malignant ones, the outcome's a little bit more variable. So we can cure some of the low-grade ones that we talked about, and that's typically why we don't recommend chemotherapy. I still want to see those dogs back, and I still want to monitor them for metastasis, for spread with routine chest x-rays and ultrasound, but the risk is low enough in these cases that I'm likely not going to recommend chemo. Guys, every case is going to be individual, and so I'm not going to make any blanket statements here. It's what's really important for me, and what I typically, when a veterinarian calls me and says, I took off this malignant mammary tumors, I usually like to see those cases, read the biopsy report, go over the case, and meet the pet and go over it in detail. So I would really, really encourage you, if your dog had a malignant mammary tumor, because some of the different biopsy types can be quite confusing, is to see an oncologist. Sometimes I do a biopsy second opinion. I have a different pathologist at the lab read that. And if you saw my update after I got back from ACVIM, talked about how important biopsy second opinions really are to get a second set of well-trained eyes on your pet's biopsy, because so much of what I recommend is based on that biopsy report. So that's a really important thing. I will often do a biopsy second opinion. Again, I talked about how size of the mass was important. So it's really important to me that someone measured it. Sometimes it's not measured, and that can be frustrating as well. And the staging. Some studies show that the disease-free interval, the 2-year disease-free interval for malignant tumors, and this is kind of clumping them together, is about 25 to 50%. So still pretty good for malignant tumors. We don't see those sort of numbers for things like hemangiosarcoma. So mammary tumors are very, very treatable, guys. They're just a huge range, again, from curable to, some that are really, really aggressive. I didn't spend too much time talking about inflammatory mammary carcinoma. I did mention that they're kind of the worst ones. These are ones that are just really, really red and ulcerated. They almost look like mastitis. They're just so inflamed when they come in, and they have a really, really crappy prognosis. I really, in general, across the board, most of the time don't recommend doing surgery in those, and we focus on a palliative comfort care program because the prognosis is just really rough. So again, just highlighting the sort of spectrum of cases that we see with mammary tumors. But again, in general, mammary tumors are super treatable. Again, 75% are cured with surgery. Only in general, about 25% require chemotherapy afterwards. Early detection is so important, right? So I talked about how size is prognostic. In most studies, in the staging system, 3 centimeters. So wouldn't it be great if you can find it even when they're smaller than 3 centimeters? So do your monthly lump and bump exam. Remember, dogs have 10 mammary glands, so you got to feel them from armpit to inner area. Check out vlog number 60 where I show you on my Penelope how to do that lump and bump exam. And another thing, remember that 50% of dogs and cats as well will have a second mammary mass. So that's why it's super, super important that if you find one mass, you feel for more. And that's what I tell veterinarians. And don't be surprised if when they're shaving your dog for surgery, they call you and say, we found a second mass. Remember, one can be benign, one can be malignant. What are you gonna do? You're gonna submit them both. But in general, even though these are common tumors, they're treatable tumors. Please, please, please watch vlog number 62 where I talk about when to spay. I do think, honestly, guys, even though everything that I talked about with these tumors, it makes sense to consider for you and your dog and your family delaying spaying, if you have a high-risk breed for some of these other cancers that I talked about. And even if you don't, but just know, I want you to just make an educated decision. I want you to have the knowledge, and that's why I do these videos, so you can make an educated decision. And just, it bums me out when people come in and say, I didn't know that, or I wish someone had explained this to me. So I'm giving you the opportunity to make an educated decision. All right, guys, that's it. I hope that you enjoyed this video. We're gonna wrap it up. Come back. We will we'll be talking about cat mammary tumors next as part of our Breast Cancer Awareness Month. Please subscribe, please share. Let me know if you like this. Did I forget anything? What else do you wanna hear? Come on, give me some topics. Comment below. Thanks so much for watching, guys. I look forward to seeing you at the next video.